Okay, part 7. And the last part. Let's go with worms for cancer. Yes, hookworms eat cancer for lunch. Or something along those lines. Come on, heading down here. Heading down. Okay. Eosinophils, which are the white blood cells that are elevated when you have a worm population, decrease your susceptibility to cancer. It appears. Obviously, go to your doctor for cancer treatment. I'm not treating cancer here, but I find this interesting and something to consider. So it enhances infiltration of the CD8 positive T cells. This sounds like something that attacks cancer. Here's low cancer, where people with high worm burdens have worms. I should say worm populations. Burdens is our old term. And high cancer, where people with previously high worm populations have been rid of their worms. Same as our autoimmune pattern, right? Highest rates of cancer in those countries populated by Nordic peoples and without worms, and lowest cancer where the highest amount of worms are. Same point, absolute highest is in the Scandinavian region, absolute lowest is the middle of Africa. Same point I just made, highest versus lowest, highest in Denmark, lowest in Niger. Hookworms stimulate cancer defense. Here we report that eosinophils were essential for tumor rejection. Tumor-homing eosinophils secreted chemicals that guided T cells into the tumor, which resulted in tumor eradication and survival. Wouldn't that be nice, especially if you could do it with just our little friend the hookworm? Thus our study presents a new concept for eosinophils in cancer that may lead to novel therapeutic strategies. Like any of these, you could just put these words online and find the actual study. I wish I had the date in there. Let's just say that I haven't heard too many studies about cancer and hookworms coming out. I wonder why. All right, so another study. This one I have some dates on. When does this come out? Oh, I don't know. Anyway, again, about the infiltration of tumors with eosinophils. And again, eosinophils are a white blood cell that is elevated with parasites. So by not having worms, we are leaving ourselves vulnerable. Again, same thing. This was 2015. I don't know if you're a cancer survivor, but I don't know if your doctor talked to you about hookworms. I am doubting it. Oh, this is a different topic. Again, Na is the good worm. That's the dog worm. Ad is the wolf worm, so we don't use the wolf worm. Very important to understand. Since these things are mostly microscopic, it's important to understand what you're dealing with. And I think I covered that, and I think I covered that, and I think we covered this. Again, there's an inverse association of eosinophil count and colorectal cancer. Means if you have high eosinophils, you have low cancer risk. Another study showed tumor-associated eosinophilia caused an improved prognosis in cancer. Again, these eosinophils are just chomping through cancer. Again, same point, more cancer. Colorectal cancer. Yep. Why did I increased another study about inverse association between eosinophils and colon cancer. Okay. More eosinophils, the better prognosis. So I would say the more worms, the better prognosis. And repeating myself on these slides here, highest rates in Denmark, lowest rates in Niger. And repeating myself in cancer there, and repeating myself there. And this is a study that shows just how it's done. In mice with peripheral blood eosinophilia, in other words, elevated worm response, there's a substantial decrease in both tumorigenicity and tumor progression, growing tumors and advancing tumors. So that's good. And multiple studies have showed improved prognosis, and I think we covered that slide again. Well, there's a couple of duplicates there. Thank you for helping me clear that up. Now let's move on to whipworm. I know we just got done with hookworm, but I don't want you to leave not knowing about whipworm. Whipworm is the hookworm of the colon. So hookworms live in a small section of the large intestines. Hookworms live in a small section of the small intestine. Whipworms live in a small section of the large intestine. And interestingly, when you have hookworms and then you add whipworms, the effect is 10 times greater than either one of those alone. And here's a study they did on monkeys suffering chronic idiopathic colitis, which means chronic diarrhea that couldn't be solved, a condition many, many people suffer with. And they gave them worms, whipworms, and they found out that it'll show it later, 4 out of 5 had their symptoms resolved, and great decrease in the amount of bacteria, and a decrease in the amount of bacteria, increase in the diversity of bacteria. So often you'll see some patients that are made worse by probiotics because they already have an excess of bacteria in their system. And these patients are the ones we would consider good candidates for whipworm. Again, this whipworm is the same that humans use because just like the hookworms, primates can share the same worms. They're biocompatible. The team speculated that the parasite stimulated extra mucus and healing. Yes, I'm sure it did. After the treatment, the bacterial communities in their colon changed substantially. Hard to do that, by the way. You can add some probiotics, but there's thousands of different bacteria, and there's a couple dozen different probiotics that are offered on the market. It might be a person needs one of the bacteria that's not offered. Is whipworm the next therapeutic worm? I believe it may be. And here again shows you the hookworms live in a small section of the small intestine, and the whipworms live in the small section of the large intestine, mostly down by the cecum and the appendix. And I wonder if that's one of the reasons we have so much appendicitis, is we don't have worms down there controlling the bacteria and inflammation. And there's some other worm approaches you may hear about if you start digging around about that. There's pig whipworm, that's TSO. You might hear TSO in the Crohn's disease study, showed no effect in Crohn's. But that's because that is pig whipworm and not human whipworm. So of course, the ancient sites that they study with human stool and find the worms that are there do not find pig whipworms, because that's not a normal part of our bioecosystem. So why would we expect it to have a therapeutic effect? You make lemons with lemonade, not oranges. If you throw in oranges, you don't have lemonade. And then there's the angel worm, which is also the rat tapeworm, which lives in the grain beetle. That's called, I forget what that's called, but if you just look up angel worm, and that lives in your gut for about 3 weeks before the gut gets rid of it. We may have been exposed to some of that because of the grains in our diet, but it wasn't, it's not a residence that's found again in these old ancient communities. All right, this is the end. So support worm research, please. You can donate with Bitcoin if you want. I just amused myself. You got to excuse me. You can support the use of worm therapy and adoption with Dash, or you can buy the new cryptocurrency Worm coin. If that amuses you, I am glad.